And hello, everyone. Welcome back to class. Hope you are doing well. This week we are looking at Chapter 5 in the textbook. This chapter is called Causation in Epidemiology. Okay, so maybe epidemiologists aren't known for being great comedians. This week we have a homework assignment, so our typical Word document, complete the homework assignment and submit it. That's going to be for 10 points. And we have this lecture number 6. If it goes beyond 20 some minutes, then we will make it be a 2-part screencast. So up until this point, we've really been working hard on establishing or understanding first prevalence versus incidence, and starting to look at potential study designs that you could do within your clinical practice. Or if you're not practicing, what kind of patient populations you've worked with in the past, that would be your clinical practice. So people are doing a nice job developing that, and we've seen that developed in the forums, and there's some really good ideas in there. And so we've continued on with understanding the typical study designs that look at determining risk or causation, and we have an appreciation now for some of the statistics used in epidemiologic study designs. So this week, next week, and the week after, so weeks 6 through 8, we're going to be looking at some additional epidemiologic concepts, but those are going to be, I don't want to use the word minor, but they are adjacent to what you're going to be doing for your poster and presentation. So my point is, now is the time to really work on your presentation and poster. We're going to be continuing to work on and reinforce our understanding of the study designs. But like I said before, the big focus between now and through week 9 should be the creation of your presentation and poster. Key messages from this chapter. Study of causation of diseases and injury is fundamental to epidemiology. Interestingly, there is seldom one single cause. Causal factors can be arranged into a hierarchy from the most proximal to the distal socioeconomic factors. Criteria for judging the evidence of causality include temporal relationship, plausibility, consistency, strength, dose-response relationships, reversibility, and study design. So let's talk a little bit about causation in epidemiology. And this is kind of an interesting concept here. So epigenetics, really kind of a fascinating thing, how we turn on or turn off our genes and how that affects our health. So here's a paper, Epigenetic Status of the Human MMP11 Gene Promoter is Altered in Patellar Tendinopathy. So patellar tendinopathy is a musculoskeletal diagnosis that I've done a little bit of work with, not a lot, just a little bit. And typically the individuals who develop patellar tendinopathy are basketball players and volleyball players, so people that jump a lot. So we would say individuals are at a greater risk if they participate in jumping sports. But how come all people don't develop? All people who play those sports develop it. How come it's maybe only a small percentage? Really kind of interesting. I played my whole high school career without developing it. So, this is kind of an example of more than one cause or an interaction between genetics and environment. And if you were able to integrate some of this type of stuff into your research, it would really take things to the next level. So, epigenetics is the study of how your behaviors and the environment can cause changes that affect the way that your genes work. Unlike genetic changes, epigenetic changes are reversible and do not change your DNA sequence, but they can change how your body reads a DNA sequence. So, two of the most commonly studied epigenetic mechanisms are DNA methylation, which is the addition of a methyl group to DNA, and histone acetylation. So, this is the addition of an acetyl group at one end of a histone molecule. Now, if methylation occurs at the gene's promoter region or at an enhancer region, the transcription of the gene into mRNA will be blocked. The result is decreased production of the protein encoded by that portion of the gene. If methylation occurs beyond a promoter or enhancer region, the researchers think that methylation enhances gene transcription. The result is increased production of the protein encoded by that portion of the gene. So researchers are thinking that methylation may be involved in the etiology of disease. For example, the methylation of PGC1 alpha promoter region is associated with reduced skeletal muscle mitochondrial content in individuals with type 2 diabetes. So now coming back to here, if the epigenetic status is changed at this gene promoter region, maybe individuals that have this genetic potential, this genetic susceptibility, are at greater risk. But it only manifests itself if people continue to stress the patellar tendon through jumping. There might be lots of people out there that are at risk at a genetic level, but never stress it to the point where they would develop patellar tendinopathy. So it's really kind of fascinating to think about. Now, a major focus of epidemiology is informing efforts to prevent and control disease and to promote health. To do this, we need to know causes of disease or injury and the ways in which these causes can be modified. An understanding of the causes of disease or injury is important not only for prevention, but also for correct diagnosis and treatment. The concept of cause is a source of controversy, though, in epidemiology. The process by which we make causal inferences, judgments linking postulated causes and their outcomes, is a major theme of the general philosophy of science, and the concept of cause has different meanings in different contexts. Cause of disease or injury is an event, condition, characteristic, or a combination of these factors which plays an important role in producing the health outcome. A cause must precede an outcome. A cause is termed sufficient when it inevitably produces or initiates an outcome. And a cause is termed necessary if an outcome cannot be developed or cannot develop in its absence. Now, some diseases are caused completely by genetic factors in the individual. Other causes of disease interact with genetic factors in making certain individuals more vulnerable than others. The term environmental causes is often used to distinguish these other causes from the genetic causes. There is nearly always, though, some genetic and some environmental component in every causal mechanism. A sufficient cause is not usually a single factor. Often it comprises several components. It is not always necessary to identify all the components of a sufficient cause before effective prevention can take place. The removal of one component may interfere with the action of others and thus prevent the disease. For example, cigarette smoking is a component of lung cancer, probably the biggest. There are some, though, who can smoke for 50 plus years and not develop the disease. So there is likely a combination of genetic and environmental factors. However, if one stops smoking, the likelihood that one develops lung cancer is extremely low. The attributable fraction can be used to quantify the likely preventative impact of eliminating a specific causal factor. From your text, this is an example in this table, age standardized lung cancer death rates in relation to tobacco use and occupational exposure to asbestos dust. So, what would be expected if asbestos workers who smoked had either never smoked or never been exposed to asbestos? Never smoking would have decreased the lung cancer death rate from 602 to 58, so a 90% reduction. Never being exposed to asbestos, but still smoking, would have reduced the rate from 602 to 123, so an 80% reduction. I always find it interesting. I should look up the reference sometime. What was the reason why there were 11 lung cancer deaths per 100,000 people in those individuals who weren't exposed to asbestos or had history of tobacco use? Was it secondhand smoke exposure? Something else? Be interesting to find out. Now let's look at the concepts of sufficient and necessary. Each sufficient cause has a necessary cause as a component. So if we look at a study of an outbreak of a foodborne infection, it could be found that a chicken salad and creamy dessert were both sufficient causes of diarrhea caused by salmonella. The ingestion of the salmonella bacteria, though, is a necessary cause. So the chicken salad or the dessert, they could be sufficient causes, but the salmonella is the necessary cause of the disease. This is an example of sufficient and necessary looking at the cause of tuberculosis. What we can see here, there are different components in the causation of tuberculosis. The necessary cause is exposure to the TB bacteria. But there are other factors which increase that risk. Crowded housing, poverty, malnutrition, genetic factors, all of those things can potentially be sufficient. Now, the usual approach in epidemiology is to begin with a disease and search for its causes, although it is possible to start with a potential cause, such as air pollution, and search for its effects. Epidemiology encompasses a whole set of relationships. For example, social class is associated with a range of health problems. Low social class, as measured by income, education, housing, occupation, leads to a general susceptibility to poor health rather than to a specific effect. A gamut of specific causes of disease could explain why poor people have poor health. Among them, excessive exposure to infectious agents due to overcrowding, lack of clean water and sanitation, insufficient and unsafe food, and dangerous working conditions. In addition, Being at the bottom of the social ladder is in itself associated with poor health even after taking all the other factors into account. Now, epidemiologists have been criticized for not using the concept of cause in the sense of being the sole requirement for the production of disease. And that view is considered to be restrictive. It does not take into account that diseases may have multiple causes, and there is benefit that is seen when you identify a cause. Maybe it's not the necessary cause, but you identify a cause and it helps to alleviate disease or injury. Think back to John Snow trying to figure out why people were getting sick, and he was looking for the contaminated water source. In the water, obviously, was the bacterial cause, but it wasn't searching for the bacteria, but rather what was making people sick. Finding that out, keeping that away from people, helped to reduce then disease. Prevention strategies often need to be directed simultaneously at more than one factor. In addition, causes can be linked to a causal pathway where one factor leads to another until eventually the specific pathogenic agent becomes present in the organ that gets damaged. This can also be called hierarchy of causes. Lab scientists, for example, might suggest that the basic cause of coronary heart disease or coronary artery disease relates to the cellular mechanisms involved in the proliferation of tissue or that proliferation of plaque in the arterial wall. Research directed at determining pathogenic relationships is obviously important, but concepts of causation need to be understood in a wider epidemiologic context. So, what do we look for as epidemiologists when it comes to coronary artery disease? What are the things that contribute to damage in the coronary arteries? Well, what we could figure out through epidemiologic studies is, does smoking, for example, increase the risk of coronary artery disease? And you could do a case control type of study and see that people that smoke have a greater proportion or percentage of individuals that have coronary artery disease compared to those maybe that don't. And that could be done prior to figuring out that cigarette smoking, what's inhaled, damages the endothelium. Same thing could be done looking at dietary habits. That could be observed prior to understanding the mechanisms involved with eating excessive sugar, eating a diet that would increase LDLs. It is often possible to make major progress in prevention by dealing only with the more remote or upstream causes. Again, it was possible to prevent cholera cases decades before the responsible organism, let alone the mechanism of action, had been identified. Now, it was interesting, though, and they highlight this in the text, that John Snow thought that a living organism was probably responsible for the disease that people were experiencing. And we'll finish off part one here with this, where, yes, it took that infection by cholera bacteria to end up causing cholera, but all these factors contributed to people being at a greater risk. The genetic, malnutrition, crowded housing, poverty, and that exposure to contaminated water. Fixing one or more of these, especially the exposure to the contaminated water, prevented then that exposure to the necessary cause.